Joining me now for more is Rania Lawendy, the CEO of Action for Humanity Canada. Rania, thank you first of all for taking the time today.
Thank you for having me.
And Rania, what is it that your organization is doing? What role are they taking in the situation right now, the humanitarian situation in Gaza?
So, we are one of the only Canadian NGOs that actually have offices in Palestine and Gaza. So, we've been there from the very beginning and prior to that. We actually are one of the organizations that gives medical aid to the Shifa hospital that was bombed earlier today. We also are doing hot meals, NFI kits, hygiene kits for people. We're trying to look into helping with shelter. Early on, we were also giving fuel. And one of the projects that we have, which is big, is one of our photovoltaic solar powered wells. So, as you know, the Israeli government has cut off power to Gaza. And so, one of the ways that people are still able to get water is through these solar powered wells.
So, Rania, what are you hearing from your colleagues then? You mentioned Al Shifa, which we just said Palestinian officials say that that hospital in particular was struck today. What are you hearing from your colleagues? What's the situation like on the
So,
ground?
yeah, the doctors, so they've been in contact with doctors there. Many of them have refused to leave because then they'd be leaving patients. So all the patients that are hooked up to machines on dialysis, the infants in the neonatal units, cancer patients, all sorts of patients are obviously still stuck in the hospital. They hit the outer courtyard of the hospital today. So many of the internally displaced people, there's actually almost an estimated 50 to 60,000 internally displaced people in the Al Shifa compound. And as you know, as your segment was saying before, this is completely against international law. The excuse that Hamas or anyone else is inside there is unacceptable, to put these civilian lives at risk and patients at risk, and doctors aren't able to get out.
And we have heard that many doctors, even if there are calls to move to further south in Gaza, that they are not leaving in more northern parts of the territory because of the patients that cannot be moved. But there are these corridors that have now been set up. This corridor north to south for 4 hours a day that we're hearing of. What have you heard about that corridor? It supposedly was opened this morning.
So, I mean, to call it to use the word humanitarian and then say this is a court, I mean, this is obviously an oxymoron in terms, because you're basically saying we're giving you 4 hours and then we're bombing again. And this is not enough time to move. So, right now, just so people understand, you have over 1 million people who have been displaced from their homes. Over 50% of Gazan residences have been damaged or hurt. You have 50,000 pregnant women. The number of orphans has originally was 30,000. Now you're into 35,000 orphans. So it's 4 hours is not enough time to even move anywhere. And we know the south of Gaza was also hit. So even though there was a call for people to go from north to south, there was still airstrikes happening in the south. We know that another school got hit also, not just Al Shifa Hospital. There's another Al Ahli Hospital. I got word from our staff that the Indonesian hospital is no longer working, and that's the only cancer hospital in Gaza because of lack of fuel. And none of the humanitarian trucks coming in are allowed to carry fuel. On a daily basis, there's about 500 trucks that would normally come in pre this conflict, and now it's less than 500 that have come in over the whole month. So it's a drop in the bucket of what is needed, and 4 hours is not enough. Like, there has to be, we are calling, and all the humanitarian organizations have come together on this. The government, we've been, advocating with the government. We need a ceasefire, but even without the ceasefire, that humanitarian corridor has to open for much longer than 4 hours in order for us to be able to do anything.
The WHO says that 20 of Gaza's 36 hospitals are no longer functioning. Arania, do you know what might happen to the patients that are in the remaining hospitals who desperately need care?
Yeah, so I mean, our common sense obviously is going to tell us, if you can't get the care, what's going to happen is these people will then become statistics on death, right? And we know that there are over 27,000 injured Gazans. So without this medical care, there is no way that they're going to survive. And we have hit. Now you're hitting genocidal numbers, right? And so you have over 11,000 people who have died. Over 5,000 children are now dead. There are thousands under the rubble that they're not able to get out. And I just, one of our staff said the statistic I think was over 2,000. 2,700 are missing persons. Over 1,000 of them are children. And I'm saying these numbers, but these are real people with real lives, real families, real hopes, real dreams. Full families are being wiped out. Like this insanity must stop. As humanitarians, we are not able to even go in and do what is needed. And the other thing is, it's going to take. I can't even wrap my mind around what it's going to take to even rebuild from the amount of infrastructure that's been damaged and been deliberately bombed. There's nothing that's safe. Not a school, not a church, not a mosque, not a hospital, not farmland, not water salination plants. Everywhere. There's no escape. Where are people supposed to go?
Rania Lawendy, CEO of Action for Humanity Canada, thank you so much for taking time today to
Thank
speak
you
with us.
for having me.